Good morning, 1FM fans, and Happy New Year. Welcome to another edition of Health Sense, supported by Glen Eagles Hospital.
Now, excuse me, I've got a bad cough after the Christmas holidays. Health Sense is a monthly series where we talk to a collective of medical and wellness specialists on a wide range of health matters. Keeping healthy is not always about bulking up and being strong. It may be an embarrassing topic to talk about, but your prostate health really does matter. And any symptoms that you experience should not be ignored. I think a lot of people tend to, it's just a niggle, I won't bother with it. We have with us urologist from Glen Eagles Hospital, Singapore, Dr. Po Biao Keong. Good morning, doctor. Thank you so much for joining us.
Thanks for having me.
Good morning, doctor.
Good morning.
By the way, if you've got any questions for our doctor, please just send them in via our Facebook page, all right? You're tuned in to Health Sense, supported by Glen Eagles Hospital. Now, Dr. Po, what are some of the detectable warning signs that your prostate is not functioning normally?
Right, unfortunately, you can't exercise your prostate gland.
Right.
It's a gland in between your legs, but you can't do anything to it as far as exercise is concerned.
Right.
Now, before we talk about prostate problems, we have to know what the prostate is, right?
Yes.
So, put it simply, the prostate is a gland that is underneath the bladder.
Okay.
And only men has it. Women do not have prostate.
Okay.
So it is like a valve, if you like. And when urine comes out from the bladder, it has to flow through the prostate.
Okay.
Okay, so for diseases, we have two types, right? One group will be benign prostate enlargement. Now, interestingly, prostate is the only human organ that becomes bigger and bigger as you grow older and older. Everything shrinks.
Yeah.
Almost everything shrinks.
Yeah, almost everything, yeah.
Yeah, except for the prostate, right?
Wow.
It's not a disease, right? It's like an aging process, if you like. Okay, so that's benign prostate enlargement. Now, the other disease will be prostate cancer.
Okay. So how do we know? How would we know?
Right. I think the greatest misconception is that if you have urinary symptoms like nighttime frequency, hesitancy, it's not as powerful jet as what it used to be. Oh, do I have prostate cancer? No, that's not true. Now, prostate cancer, early prostate cancer has absolutely no symptoms. So the symptoms that I talked about is a feature of benign enlargement of the prostate. Yeah, so if you have the symptoms that I talked about, you ought to see a doctor. But prostate cancer has zero symptoms.
Oh. How often should we screen for prostate cancer?
So if you talk about screening, then we are talking about prostate cancer because you screen for a disease if there are no obvious symptoms. Because if there are, then there's no screening to talk about, right? So for prostate cancer, we have to talk about the risk groups. So it happens to men above the age of 50 years old.
Okay.
Earlier, if you have a very, very strong family history of prostate cancer. So beyond the age of 50, the recommended, I wouldn't call it screening, but you would like to talk to your GP or your urologist once a year.
Once a year.
Do a blood test, do some physical examination.
Right. What irritates the prostate? I mean, for someone who is sexually active, does it is that person more prone to
not really
problematic prostate?
I don't think it is whether or not you are sexually active, right? Even if you're sexually inactive, you can very well have prostate inflammation.
Right.
And the activity level of sex, right, or the frequency of sex has no correlation with the propensity of prostate cancer. So it doesn't mean that if you're a virgin, you're safe from having prostate cancer.
Right.
Now then we have to bring in a third disease of the prostate, and that's prostate inflammation or infection. Well, that is an enigma. It's very, very poorly understood. Right? Give me prostate enlargement or prostate cancer anytime as a physician. But when patients have prostate infection, it's just a tough nut to crack.
But how do I then? I'm looking at a brand new year. I'm hearing you talk about prostate problems. How do I, if I can't if exercise is not the issue, how do I improve my lifestyle to prevent prostate problems?
All right. Now, then we talk about prostate cancer. Right. Let's start with smoking.
Okay.
For the longest time, smoking has not been implicated in increasing the chance of prostate cancer. Until 2 to 3 years ago, we have new data to say that if you smoke regularly, your chance of getting prostate cancer will not increase. But if you were to get prostate cancer, chances are you will get a high-grade one, a life-threatening one. So cancer is correlated with an aggressive form of prostate cancer.
Okay.
Then we talk about diet. Now, there are studies to show that if you are fond of high heat or of foods that are prepared with high heat, like your barbecue meats, your bakwa, goreng-goreng, satay and all that, the chance of getting prostate cancer is higher.
Why is that?
I suppose burnt proteins has been found to be cancer-causing. Yeah, so
the charred bits and all that are bad.
The best stuff, right?
The best stuff, but they're the worst,
right?
Yeah.
Apparently.
Oh
Right,
man,
so
The charred bits on the bakwa.
Yeah,
I know.
Yes, and the chashu, right?
Yeah.
Yeah. So that's what not to take, right? Now, what seems to be protective for prostate cancer would be your phytoestrogens, your soy products, your tauhu, tauquah, your soy milk. Those seems to have a protective effect on prostate cancer incidence.
Okay.
The second group of foods will be foods that is rich in lycopenes.
Okay.
I call it the red-colored fruits and vegetables, like your tomatoes, your persimmons, and your carrots. Those seems to have a protective effect towards prostate cancer.
That's a double-edged sword, isn't it? Because I've also heard recently that too many tomatoes are bad for your gut.
Yeah, I heard about that as well.
For that, we're going to bring back Dr. Louis.
Yeah, we're going to bring back Dr. Lear about that. Because apparently there's something in the tomato skin, apparently, that creates leaky gut. But anyway.
Yeah, and I've heard stuff about soy products. You know, how, if I were to consume soy products, I would develop man boobs.
Oh, I don't know. I don't consume soy, and I got man boobs.
That's not true. It's phytoestrogen, right? It's not estrogen. My son asked me that. So do I get boobs if I drink so much soya? No, you don't.
Yeah.
Now,
I love soya, so I've continued to consume soya and eat tau hui and stuff like that. It's great. But it's nice to hear it from you that it is not harmful. Because I think more and more people are trying to avoid soy products because they've been hearing all these weird things about it.
If you look at it, interestingly, the world's, if you compare all the ethnicity in the whole world, the group of people that have the lowest incidence of prostate cancer will be the Japanese.
And they consume an awesome amount of soy.
Yes, but if this group, there's a study to show that if this group of Japanese migrate to the West and adopt a Western diet, the incidence rate of prostate cancer goes up.
Right.
So their genes didn't change, but their diet did.
Their diet did. Okay, assuming one has prostate cancer and you go for surgery, one of the things people always bring up is urinary incontinence after that surgery.
Sure.
Is that true? It's
true, but the technique and the hardware that we use to take out the prostate from the body has undergone so much improvement that incidence of incontinence after robotic prostate surgery is, I would say, less than 3%. And there are ways that we can do to prevent or mitigate these risks.
Okay, here's a new term we've heard on Health Sense: robotic surgery. What are we talking about?
Well, it's just using the robot to take out the prostate, right?
So, but you're there, right?
Yeah. So, before we talk about robotic surgery, we have to understand how is the robot taken out from the prostate, from the body, right?
Yeah.
The prostate taken out from the body. So the prostate is beneath the bladder. It stands between the bladder and the penis.
Okay.
So in prostatectomy, we remove the prostate and we short circuit the urinary tract. Okay, and because of this, there is a small incidence that you can have incontinence. Now, in robotic prostatectomy, we do the surgery using a robot. Now, we have about 4 robotic arms holding instruments, keyhole surgery, if you like. So, robotic surgery is a form of keyhole surgery.
Right.
Instead of me holding the keyhole instruments, the robotic arms will hold the keyhole instruments.
Okay.
And then I will be next to the machine operating a console. It's like arcade games, right?
Right.
Yeah. Wow. Yes. So I'll be at the console controlling the robot.
But it's much more precise.
Absolutely. Much more precise, and we get a 3-dimensional appreciation of the operative field.
Okay, so for successful prostate removal,
Yes.
After the patient heals up and all that, he's back to normal. He can live a normal, healthy life.
But the two main, I would say, functional impediment would be the small risk of urinary incontinence, and the second would be a risk of erectile dysfunction.
Oh,
Okay.
Is that risk very high, or is it small?
I would say it's not low, but with the advent of robotic surgery, because of the precision, the magnification, and the three-dimensional appreciation of the operative field, we can see the neurovascular bundle very clearly, and we can avoid damaging these nerves in the process of taking out the prostate.
but still, I mean, that's a risk.
Yes.
I was about to ask you to just remove your prostate right now, FD. But I think
I'm
that's
63 years old. I don't have long more to go. So let's keep it all working
Exactly.
properly. Thank you very much. After you've done the surgery, you've done a biopsy and stuff like that, you've removed the prostate.
Yes.
Do you see many cases of the cancer spreading to other parts of the body?
Well, there is a huge controversy about whether to screen for prostate cancers or not.
Yeah.
Well, the controversy is still out there, right? The jury is still out as to whether we should or should not screen for prostate cancer. Now, anecdotally, personally, we have seen a stage change over the past 10 years. In the past 10 years, we have seen prostate cancers coming to us at a much, much earlier stage, at a much, much curable stage. So it all depends on when the patient comes.
Yeah.
If the patient comes late, then it's going to be hard to cure.
Yeah. So basically, curing prostate cancer is to remove the prostate. I
Correct.
mean, there's no other way to.
Well, if the patient is much older
Yeah.
and surgical risk is much higher because of other medical issues,
Right.
we have the option of radiotherapy.
Okay.
Yeah, but radiotherapy has its own set of complications.
right.
Wow.
How common are prostate issues here in Singapore? I mean,
Prostate enlargement is very, very common. It's almost a certainty. The older you are, so a good way to remember would be if you're 50 years old, it's 50%, 60 years old, 60%. So the older you are, the higher the risk of prostate enlargement. That's the benign prostate enlargement. Now, for prostate cancer, the incidence has also risen. It used to be the fifth commonest prostate cancers about 10 years ago. Now it's the third.
Wow.
So
That's a big
it's rising.
That's a very big
It
climb.
might be due to diet.
So, with that enlargement of the prostate, assuming it's benign enlargement, does it affect your body in any way?
Oh,
Has
yes.
it?
Yes.
How?
So, looking back at the basic anatomy of the prostate, it's really like a valve controlling the bladder outflow.
Yes.
So, if this organ were to enlarge, the hole in the center, right, through which the urine passes, will become smaller. And it causes obstruction.
Right.
And a whole host of symptoms you will experience.
and that's why you go to the toilet more frequently.
Frequently, poor flow, the first to go in, last to come out.
Yeah.
Dribble.
Yeah. Wow. Interesting.
Oh boy.
Good to know I haven't reached that stage yet. I don't know whether you wanted to know that or not, but I just thought I'd tell you. Just in case you wanted
It's
to know.
We're close.
Do we have any questions on our Facebook page?
Yes, we do actually. Doctor, I've got a question here from Paul who says, how much discomfort must one endure before an accurate diagnosis can be arrived at?
Okay, all right. So maybe I should try to paraphrase that.
Yeah.
So when it becomes abnormal, when how much discomfort you must feel before you go see a doctor.
Yeah.
Now, to me, any change from what it used to be in the past, I think you have to raise alarm bells. Like what we have said, multiple visits to the toilet at night, and you dribble, and you have to wait for a long while before the urine comes out. I think one of the worst symptoms will be peeing blood.
Oh.
That will be pretty.
Oh, so that is a sign.
One of the signs. So if you pee blood, don't wait. Go see a doctor.
But what causes that though? I mean, peeing a little bit at a time is one thing, and you mentioning that the hole gets smaller and all that, but what causes the blood?
So if you pee blood, and if you talk about prostate cancer, I think it's pretty late already. So for the prostate cancer to invade into the urinary tract and cause bleeding, you need something done.
Does it mean it's infected the kidneys?
Either, well, it can be a kidney infection, but we are talking about painless blood in the urine.
Oh.
That means
Painless
painless,
blood.
no symptoms.
Okay, you're right.
It's just peeing blood in the urine. And that's a sinister sign.
Wow. Okay, you've heard all the signs, you understand what it is, and you know what needs to be done. Dr. Po, thank you so much for joining us.
My pleasure.
Absolutely
Thank you very much.
brilliant.
And Happy New Year once again.
Right,
Thank you.
Good times. Greatest hits. 1FM 91.3.